Good afternoon, I'm Dr. Madhuri Agarwal, consultant dermatologist and aesthetic physician. You're watching me on Sifi.com.
Please update on cosmetic procedures such as injectables and advanced technologies.
Currently, in the last few years, we have seen a boom of awareness and interest in the consumers about cosmetic dermatology, as well as the interest and awareness in their looks. So there are a lot of new procedures which have come in, like injectables such as Botox, Dysport, Restylane, Perlane. So these are the fillers which are non-surgical. They do not have a downtime, and people can do it in their lunchtime, get younger, fuller, pleasant looks, and go away to their works without anybody knowing they have done procedures. So a lot of people are opting for such procedures. The other is there's something called as skin boosters, which is just to hydrate your skin, make the skin more soft, supple and glowing. So this is another procedure which is very commonly done by our consumers. The other thing is there are a lot of advanced technologies which have come in the Indian market, which again are options for non-surgical procedures, like you have your radio frequency devices such as Thermage, Exilis Elite, which helps in skin tightening and contouring your faces and bodies. We have lasers for hair reduction, which is already existing, and we also have newer devices like Q-switch laser for fairness and skin lightening. And we also have new things like PRP, which is your platelet-rich plasma, for natural skin and hair rejuvenation when people don't want to go in for chemicals and lasers and injectables. So there's a whole plethora and armament of procedures with minimal downtime, no surgeries, makes you look young, fresh and glowing in an instant.
The must-use products for skin care.
So there are certain products which are must-use. We all know there is this three-step cleansing, toning and moisturizing regime, but I normally also recommend two more products. One is definitely your cleanser, toner and moisturizer, but a sunscreen and an eye serum is something which I recommend you should invest in. So your cleansing will be like a face wash to cleanse the dirt and debris. A toner will help to hydrate and make sure your skin is good to go, and then you add on your moisturizer with a sunscreen to protect your skin throughout the day. Last and most neglected area is the eye, but that again is a common concern with nowadays lifestyle, like a dark circle. So I do advise that you should invest in a good eye serum based on a recommendation by your dermatologist.
The must-do treatments to maintain skin health.
Okay, so previously in the past, people used to hesitate to do skin treatments. However, times in the last few years have changed. Besides doing your product regime, people do want to go for some skin treatments which actually give benefits vis-a-vis going to a salon and doing a facials. So a lot of them, I advise a basic thing would be either a chemical peel or a microdermabrasion. If you do this monthly, what it would do is it will take care of your dead skin buildup. It will take care of any tan that you're getting. It would also take care of your active acne or acne marks, and overall make a change in your skin in terms of giving you more healthier and evened out skin, which is what people look for nowadays. So one is either a chemical peel which takes care chemically of your dead skin buildup and rejuvenates your skin, and the other is microdermabrasion. And the third thing which a lot of people now I advise is also your laser photo rejuvenation, which again is an early anti-aging service which people can opt for once a month.
Ensurance of an appropriate level of sun protection for all seasons.
So sunscreen, there are a lot of myths and stories surrounding sunscreen. People look for SPF, and then there's no end to SPF. You have SPF 50 and 70. However, now the recent FDA guidelines suggest that you should go for a broad spectrum sunscreen. That is, what does a broad spectrum sunscreen mean? It would take care of your UVA as well as a UVB sun ray protection. Along with that, a minimum SPF 15 to 30 is good enough, because most of us lead a sedentary life unless you're out on a beach wherein you would need a higher SPF. And very important, which I tell my patients, is you should be using a sunscreen even indoors, because most of us stay indoors, but the sun ray, especially UVA, penetrates your windows and affects you even when you're at home. So make sure you make a habit of applying a sunscreen in the morning when you start your day, and reapply if you're going out every 2 hours. That is the ideal way of using a sunscreen.
Anti-aging skincare tips.
So anti-aging, yes, we Indians age very differently than what a European skin age. What are the early signs of aging in Indian skin that we see is your skin becomes more coarser, the pores become more prominent and larger and increase in number, and also we start becoming more darker. So we don't have those typical lines. So very important is to invest in a good sunscreen. It is a must for all seasons for all of us. The other thing what you should also do is make sure what you eat, because what you put in your body is very essential to prevent your aging. So make sure you have a good diet enriched with the right kind of foods, avoid processed foods and too much of sugar. Also have plenty of water, because as they rightly say, 8 glasses of water does hydrate your skin and helps to repair your skin. The other thing is, when you're going for a routine, go for a smart routine wherein you have a morning sunscreen, but night there's a lot of night creams which are enriched with your peptides, your retinoids and a lot of other anti-aging creams. In case you're confused, consult your dermatologist who can guide you what product you should go for your skin and is right and gives you the optimum results with minimum cost. So these are the things. And the last thing what I also suggest is invest in a skincare procedure which helps to regenerate and rebuild your skin and thereby prevents aging. Like as I mentioned, your chemical peels, your laser photo rejuvenation and your radio frequency devices.
Current treatments for fairness and improving skin color.
So fairness is a great demand in India, despite our refusal to accept it. People do come in asking for, I want an even skin, I want a better looking skin, I want a better texture skin, instead of saying fairer skin. So it is a in demand industry, it's a growing industry, and what I suggest is make sure that you use the right kind of skincare products. One is definitely a sunscreen to prevent the tanning and aging. The other what I would also recommend is look at what creams you're picking up, because a lot of them pick up these over-the-counter steroids which spoil the skin. So go for preparations which have vitamin C, retinoids, licorice. So these are lightening agents which are natural, do not harm the skin and really help you give the fairness. And last not the least is there are these new procedures like your Q-switch lasers. You have got these PRP treatments and laser photofacials which really help to lighten the skin color, rejuvenate it, and without harming the skin in the long run. So these are very popular treatments and people can go for it without any downtime and with a high safety benefit.